Hi there, I'm Hendrik Huthoff, the Head of Education at the Jena School for Microbial Communication at the Friedrich Schiller University in Jena, Germany. And that is a graduate school in microbiology, so a PhD program. And I have been a mental health advocate for some time now. That really has its origin in my own early days at university as a bachelor's, then master's and PhD student, when I suffered from an anxiety disorder. That really came to a crisis towards the end of my PhDs, in the phase of writing the thesis and preparing for the defense. That is when I finally decided to seek help, had about half a year of cognitive behavioral therapy, and that really worked brilliantly. And I'm a fairly typical case, and this is well known in psychology, that it takes people on average about 8 years to find or accept the appropriate help from the onset of their mental illness. And so I try to get the message out there, first of all, that it's okay not to be okay. Secondly, that help is available. And thirdly, that it works. So I've started to implement a number of things that I'll get back to in more detail as I carry on here at the university where I now work at. I came to Germany in 2017 after having worked for about 14 years in the UK, where I was eventually also leading my own research group and had to deal with the mental health problems of some of my lab members or students as well. So I've seen the impact of mental health problems on all sorts of levels, from the personal to friends, actually family as well, and colleagues. And as I've indicated, I know the beneficial impact that the correct support can have. So moving to Germany, I found that there are some rather specific situations here that are really rather different than I suppose they are in some other countries, and the ones I'm familiar with are the UK and the Netherlands. So in Germany, it is actually customary or common that the psychological support is not part of the occupational health at the universities, but is offered by a separate organization. It's here called Studierendenwerk, so it's an organization for students that is state-run. This is on the one hand, there's benefit and drawbacks to anything. Of course, that's a very professional service. I have no beef with that at all. But it does create a disconnect between the organization that offers the support and the university. They are not formally part of the same organization. And so there isn't a guaranteed dialogue, let's put it that way. So I saw that there was really a need for a place at our university for students to go to, which is easily accessible, and so I've started implementing, and we've achieved that at the beginning of this year, 2021, a mental health first aid team. So a number of us with a similar interest, mainly from the managerial layer of the university, had ourselves trained as mental health first aiders, and so we now have a team that students and employees of the university can come to if they feel they have some mental health issues that they'd like to talk about. And of course, in the setting of the pandemic, all of these consultations currently happen online, which I have found that actually has a lot of advantages to it as well. It guarantees a certain level of anonymity. People aren't seen to be walking in and out of somebody's office who is known to be a mental health first aider or counsellor. And it also sets a clear time window for such a consultation to take place. And it's been really quite a success at our university. I've had feedback from several students, even after 1 or 2 consultations, that this has really helped them. I would say that the most common cases that I've had are those who have anxieties about graduating, about handing in their thesis, about defending their thesis. And of course, having gone through that myself and having suffered an anxiety disorder myself and being a mental health first aider, that must be foremost, of course, I found has really benefited me in offering the right kind of support, and I've had several cases of feedback where people said that they found it very helpful indeed. So on top of that, I'm also a member of an organization here in Germany based in Leipzig that is called Irrsinnig Menschlich, which roughly translates as insanely human. And they are very much involved with prevention and educating about mental health. They offer fora to study in a mentally healthy way, to maintain your mental health while at university. And they've been also extremely successful, particularly in the last year during the pandemic, by offering their fora online. A lot of interest from different universities, and so that organization has really grown. And I'm also now part of the working group on mental health for the German University Association, where we hope to publish in the course of 2022 a set of guidelines or recommendations for universities in Germany to implement. And I would venture to guess that mental health first aid would be likely one of those recommendations. Now, in the context of digital mental health, there's one thing that is a problem for me that I really haven't come up with a solution for. So our body of PhDs, postdoc students, obviously is very international. And it isn't a given, let's put it that way, that a psychologist, and particularly in psychiatry for more severe cases, that adequate treatment in a language other than German can be provided. And there certainly is a need for it. At the same time, there is a lot of support out there digitally, online, right? Be it through apps or through online consultations with psychiatrists, psychologists more likely actually. However, it is, for me at least, and I imagine for students as well, a difficult to oversee field of offers that you got. And how do we distinguish what is bona fide, what is of good quality, and what are perhaps rogue elements in this field as well. So this is something that I would really like to gain out of the Digital Mental Health Conference this year, is to gain an understanding how we identify what are good digital or online support structures, and perhaps as part of the work for the German University Association, to issue a set of guidelines or a checklist of how you could identify the sort of online help that is right for you. So I'm really looking forward to some exchange of ideas on this matter, and if anybody has any suggestions, you won't find it difficult to find me online, so drop me an email with your questions, suggestions, or if you wish to debate this subject with me further, I believe I am going to be part of one of the panel discussions here, and so I really look forward to the insights I hope to gain out of this exciting conference. Bye bye and take care.